what is medical weight loss? And what we're going to do in the webinar is just that, kind of dig in a little bit to help people understand what is medical weight loss and maybe whether it could be right for them. We're going to be happy to take your questions. So we have some prepared material that we're going to kind of go through first, just to cover the basics. And then we'd be happy, as was said before, if you post some questions in the chat. So I'm Dr. Florencia Halperin, and I'm the Chief Medical Officer at Form Health, as has already been introduced. And Julia, I'll let you introduce yourself as well.
Thank you. So glad to be here. I'm Julia Axelbaum. I'm the lead dietitian at Form Health. And like Dr. Halperin said, thank you guys so much for being here and taking the time to really listen and learn more about our program. So I guess let's get started with the main question that many people are here to learn about is people want to know, Dr. Halperin, what is medical weight loss? So would you tell us a little bit about how you would answer that question to someone who asked it?
Great. So my first answer is very short, very simple, and then I'm going to get into some more details. But put very simply, medical weight loss is working with a medical doctors or sometimes a team of healthcare professionals that are supervised by that doctor to lose weight with the goal of losing weight. So let's talk a little bit more about what that means. So probably everybody here knows, maybe from personal experience, that many people want to lose weight. And we all know that you can find many ways to do that. You can buy a book, you can join a group on social media, you can kind of do it at work sometimes. There are lots of different options that you can try. And most people who want to lose weight have actually tried one of these things before. Sometimes they've tried many things, sometimes they've tried it many times. So part of what I want to highlight and get a little bit more depth into is how is medical weight loss different from some of those other options that a person has if they want to lose weight. So one of the most important things that I think is true about medical weight loss is that we take a different approach from what you can do on your own, because we're really treating this as a health condition. So incredible science over the last few decades has taught us that our biology regulates our weight. It's really interesting and very complex, but hormones, the gut, the brain, all of these parts of our body are really deciding what weight our body wants to be at. And what that means is that it's not a person's fault. It's not a personal choice what weight you're at. And just like hair color or height or many other things that biology regulates, this is something that we are, in part determined by our genes and what we're born with. So as part of a medical approach, we don't blame people, we don't shame people. And just that approach by itself is a big relief to many of the patients that I've worked with. It also means that we're not here to lose weight for 3 weeks and then, throw it all away and see the weight come back, because that's the set point that our bodies will regulate to. So what we're really after is a long-term health benefit. So we want to help people lose weight and keep it off over time. So I think those two things are really important to highlight as kind of the overarching philosophy. But then let's get into kind of more specifics about what we do, when we're actually working with someone to achieve medical weight loss. So the first thing is really to know the person and to offer deeper insights than you can get in other ways about what is happening, why is there difficulty losing, why is there weight gain, and what is the best strategy to tackle weight loss. And I can tell you, I've been in practice for more than 20 years, and I've never come up with the exact same plan for 2 different people. Every person is unique. So it's really important to do this initial step of really understanding the person so that we can develop the best treatment plan. So we start by looking at the why. Why might this person have trouble losing weight or been gaining weight? We do lab tests. Sometimes we do other blood work or other testing to try to understand some of the underlying reasons. And then we look for consequences, because excess weight has a lot of health consequences. We need to really understand them. Some of them may need to be treated or maybe blockers to being able to lose weight. So an example of something we might discover when we look for the consequences of excess weight is prediabetes. And if we find that, we would, help with treatment there as well. And once we've kind of done some work to understand some of the underlying health factors or health consequences, we have to really dig deep to understand like what has worked for this person, what hasn't worked, what patterns have they, you know, kind of realized over all of their trials, and really understand what are the barriers for this person, what motivates them to lose weight, why do they want to do this. All of this deep understanding of the person is a really important part of the next step, which is building the personalized plan, you know, focusing on how can we help this individual be successful at losing weight. And again, I can tell you there isn't one formula for everybody. This is not cookie cutter. This is understanding each individual and then formulating a plan that works for them. But we do use similar tools. We have a big toolbox, and within that toolbox, we can implement it in different combinations or at different times to help the person be successful. One of the things that's really key about working with medical professionals is that although there's a lot of quackery out there, there are a lot of people who will try to sell you stuff that they promise will work with no effort. What we're really focused on is using the tools that science has proven will work. So a lot of studies have been done on how people can successfully lose weight. And those are the tools that have had studies behind them that show some proof that they work is the ones that we're going to be working with as a medical team. But for everybody, we do address certain basic buckets. So we always work on nutrition. We always work on physical activity. We always work on behaviors and establishing habits so we can obtain that long-term success that we've talked about. And sometimes we use medications, which I'm going to talk a little bit more about. We also may need to change the tools, and what works in the beginning may be different for what works later. So we have to kind of also understand the biology as the body loses weight and how the body reacts to different kinds of treatments. And we can't make all the changes at once. So we build a little bit at a time to kind of add up to big changes and get lasting results. When all of this is working together and we're changing the nutrition and we're changing the physical activity and we're helping people build long-term habits, in some cases, we also use weight loss medications because that's what can really target that biology that I was talking about. The brain and the gut and the hormones that regulate weight are targeted and changed by some of the medications. Oh,
oops.
Yeah, thank you everyone for muting. So we'll talk a little bit more about medications because I know that's something a lot of people have questions about. But I just want to also highlight that this kind of working with a medical team and medical weight loss, it's not a one-time thing. You don't just come and get your solution and leave. This is really a journey and a long-term relationship. And as the body's changing, as the weight loss is progressing, as we're learning more about the individual, we often have to change the plan to make it continue to work. And we really continue to support people because studies very clearly show that the more accountability and the more support that you have and the more touch points with your team, the more likely you are to be successul. And then I'm talking a lot, so I'm just going to say one last thing, which is that we are not really solely focused on the number on the scale. Of course, when people come for medical weight loss, they want to lose weight. But since our approach is really long-term, long-lasting, and about health, what we're really trying to do is improve people's health, prevent medical conditions, and improve well-being. So we help people also sort of look at all the things that are improving along the way as the weight is coming down. And so we continue to measure some of those labs and do some of those tests and see kind of all of the things that are improving. Sometimes we're following symptoms and things are improving as people are losing weight. And that's a really important part of our focus to improve health, prevent disease, and just help people live healthier lives where they're feeling better. Okay, so I think we have some room still to break down even further some of these pieces. So since we have Julia, who's our wonderful lead dietitian, let's talk about a little bit more color on how you work with patients to change their nutrition, to change their behavior and their habits. I think you can create a really good picture for us about what this is actually like in the day-to-day treatment.
For sure, for sure. And I see we're getting some questions also kind of asking, like, what does a plan look like? You know, what am I going to be eating? What am I going to be doing with Form Health? So I'll definitely get into that as well. So I guess first thing to say is not everybody struggles with weight for the same reason, right? For different people, there are different things that may be getting in the way. There are some people that I see that have actually very healthy diets. They eat, high quality foods. They may not even be eating large portions at meals, but their struggle really is with snacking or emotional triggers for eating. And so for patients like this, just handing them a diet plan is not going to fix what's really going on. I see this all the time where, I work with patients who have tried so many different diets before unsuccessfully, and they feel like a failure. And what I tell them all the time is the truth is, the diet was a failure. The diet wasn't meant for you. It wasn't addressing, the real issue that was going on. So with patients like this, where the underlying struggle is with emotional eating, our dietitians are trained in using cognitive behavioral therapy techniques to help patients break bad habits, work through emotional eating episodes, avoid self-sabotage, strategize for high-risk situations. And then for other patients, sometimes the struggle is with finding a sustainable eating approach. A lot of people have been on many different diets before, which have been either highly restrictive, leaving them feeling hungry, or maybe leaving them feeling really low energy, or feeling like, okay, I could lose the weight, but I can't keep it off. How am I supposed to keep eating like this for the rest of my life? And so what we do to kind of approach that is we teach a simple plating approach to building meals and snacks that help our patients feel full and satisfied, include all the food groups. We never, have a food group that like carbs where we say you can never eat that again. And we also try to move away from calorie counting or doing any complicated math. I always say you shouldn't need, a fancy calculus calculator in order to lose weight and keep it off. And so instead we use simple visualization techniques to help our patients kind of look down at their plate and eyeball what a weight loss meal will look like. And the feedback that we get from this is that it's not something people feel like is too restrictive. It's something they can really see themselves following for life. It's not a fad or short-term fix. Mm-hmm. And I would say overall, our belief, as Dr. Halperin was saying, is we understand that it's all about those small changes that add up over time. So we really work one-on-one with our patients to strategize and come up with techniques that they can implement realistically into their lives, one at a time, to continue to build on those things, really one at a time, and start to see those long-lasting results over time.
And Julia, this is so great. I'm so lucky to work with Julia. She's so wonderful. She helps people make such meaningful changes. But give us even a little more depth into like, what might people be eating? Because I think that's one thing that people ask a lot of questions about, like, what are they actually eating in the context of all the things that you've been describing?
Sure. So people are so different. So we, like you were talking about how
this is a theme.
Yeah, I mean, very similar to you saying how you never have two people who are on the same plan. I honestly don't have two patients who are eating the exact same diet plan. The plans are completely customized to each person's unique situation. So for example, I work with some patients who are just really not hungry in the mornings. And they've heard they have to eat breakfast, eat breakfast, but they've been fighting it because they're just really not hungry. Well, with these patients, actually, sometimes we like to work on a time restricted eating plan, an intermittent fasting kind of plan, where we actually push the start of their eating habits until later in the day, maybe 11 or 12 in the afternoon. I have some patients who do really well with low carb diets, and that helps, really satisfy their cravings and they don't feel snacky. I have other patients who need their carbs, otherwise they feel really low energy and cranky. I work with some patients who are busy professionals and, during the day, they're really not interested in or feel like they have the time to think about cooking real meals or sitting down for, plated meals. And so for patients like that, actually, sometimes we'll use partial meal replacements during the day, where during the day they'll use high protein shakes and bars and puddings and soups. And then when they come home at night, they can sit down for a nice healthy meal with their family. So overall, I would say, our focus is really finding a sustainable approach that fits into the person's life. I always say that any diet that you can see yourself only following temporarily means it's only going to lead to temporary results. And so we really work with understanding each person's preferences and past experiences to truly find a plan that they can see themselves following for life. But the one thing I will say is that sometimes we do make a lot of progress on eating, on behavior change, but patients still have a hard time losing weight. They're still struggling. And in these cases, that's when I've seen many of our doctors talk with patients about using weight loss medications and how they can help in combination with the changes that they're making with their dietitian. So maybe it'd be helpful to talk a little bit more kind of about the medication route and sort of give more clarity on that.
Great. Yes, thank you. I'll talk more about that. And I see that some people have posted questions about that. So this is a great opportunity to address that. So thank you for what you said. I feel you've painted such a great picture of how we have a lot of different tools and we're not stuck with one. We're just really trying to use all the tools that science tells us can work to find the right thing for the right person at the right time. And this is the same way that we approach medication. So just as Julia kind of alluded to, the situation in which we think about putting someone or offering someone, let's say, a weight loss medication, because it's always a shared decision, is when they're doing all of the work that Julia has described. They're really making progress on healthy eating. They're on track with physical activity to the extent that they can be, and they're kind of working on their mindset and their behaviors. And we still don't see progress. And this happens. This is real. We don't think people are not doing, what they're supposed to be doing, and other things that we hear people say, even from other medical professions. We know this is real because this is when we're kind of up against the biology of the weight regulation of this body. And so what we can do with weight loss medications is change some of the chemistry to help the body feel full or not want food at a different set point. So there are many weight loss medications, but almost all of the ones that we use work in the brain in the signals that tell your body that you're full, that tell your body that you want food, that you're experiencing hunger, and they turn those signals down in some cases and up in some cases, depending on the medication. But so basically people have fewer cravings, they feel full with a smaller portion, they want food less frequently. And that's how the medications work as in general. Now, the only medications that we use and the only medications I would ever recommend that anybody take for weight loss are the ones that are FDA approved. When the FDA, which is our government body that regulates medications, has approved it, that means they've done a very rigorous study of the safety and the efficacy, how it works, and has thought that on the balance, this is, more useful and more safe and not. And so they allow it to go on the market. So anything that is not FDA approved, that's a supplement, something you buy on the internet, without a prescription, I would really caution people. Those things are out there and they can really harm people. So because a very common question about medications is, are they safe? Not everything is safe if they're supplements or, things from the garden, but if they're FDA regulated, the medications that we currently have available have really stood the test of time, have really had a lot of rigorous testing, and a lot of published studies show that they are safe. Someone asked specifically about medications, and I'm not sure if people wanted medication names, but some of the FDA approved medications for weight loss include Saxenda and Wegovy and Contrave, and there's some generic medications like phentermine and sometimes metformin or topiramate or other medications that are approved for they are approved by the FDA, but they're approved for other indications. But studies have shown that they help people lose weight. So sometimes doctors would also prescribe that. But the decision about which medication for which person and when is very individualized. And, it's a decision that we take very seriously because there are many reasons why one medication may not be right for an individual. And the other really key thing is that everything that Julia and I have been talking about in terms of making healthy lifestyle changes, it really goes together. All the studies that show that medications work also gave people the support and the accountability and the lifestyle change. So the medications work together. And I would caution people, like, if you have a physician who's just going to hand you a prescription and then not see you back in a year. That's not the way these medications are supposed to be prescribed. They're supposed to be prescribed in the context of someone really also doing the lifestyle work.
And one thing I'll add, that I'll just kind of add to talk a little bit more sort of about our program and kind of how it works, is all of our patients are set up to work with an obesity medicine doctor, a registered dietitian, board certified in weight management. And with this team, honestly, in all of the work I've ever done, I've never seen as high level a support team as you get here. We are in touch with our patients for telehealth visits every 2 weeks. So every 2 weeks, we sign on to video chats. We're talking through successes, challenges, we're setting goals. But then in between those visits, we actually are texting back and forth. So patients can text back and forth with their care team, with their doctor, with their dietitian. And we're in touch talking through, what's working, what's not working in the plan that we set. Patients are sending in photos through their photo food journal to keep track of what they're eating and get feedback and tips from their dietitian. Something else that's really cool is because it's kind of like you have your dietitian in your pocket at all times. I have patients who are, at the grocery store and need advice figuring out, between two different products, or they're going out to eat that night and maybe they'll text me asking, can you look over the menu with me to figure out, what's a good choice for me to order tonight? So we, not only develop these really close relationships with our patients where they can really count on us as a support system, but because we're in such constant communication, I feel like we also are able to constantly tweak and refine the weight loss plan to really perfect it until we sort of figure out, what works best for each person's body in terms of nutrition, physical activity, behavior change, and also the medication.
Yeah, those are such great points. Julia, we're getting a lot of questions, which is so great. So even if it's a little sort of peppered instead of in an organized way, I just want to make sure that I answer all the people who took the time to listen and have questions. So let me just go back to medications for 1 second to address a couple of specific questions. And then people also have questions about success rate. So we should talk a little bit about results. Someone asked about medications off label, which I think I addressed. Some are approved for weight loss specifically, some are approved for other indications, but they are approved. And really the physicians, and I think this is true in general, medical weight loss, certainly in our program at Form Health, they're really trying to find the best match for the person. And that includes sometimes if the person does have diabetes and there's a medication that causes weight loss and also improves diabetes, well, that would be a great medication for this person because you're treating two things at once. Or if someone has a lot of headaches, one of the medications that is off-label can actually help to decrease headaches, but also causes weight loss. So we might think about that medication. We're really individualizing the decision from a big, well, it's not huge compared to the treatments for other medical conditions, but we do have some choices. And the medication may be started, someone else asked, right at the beginning, if the person has had a long journey with losing and regaining, or the team may decide like the person really wants to focus on the lifestyle and the work with the dietitian first and bring the medication in if it's needed at a different point in the journey. It's completely individualized. And someone asked about cost, and cost is a reality with weight loss medications, and it is part of the consideration when we're discussing a medication choice with someone. We know sometimes that insurance doesn't cover this or that, so then we're not going to give someone a super expensive medication if it's not in their insurance plan, and we're going to work with something else. So it is one of the considerations along with some of the medical reasons why we might pick one thing versus another. And I see also that I think someone else is responding to some of the questions. Okay, so let's turn in the last few minutes to results, which obviously people want to hear a lot about. So the kind of medical societies that are experts in weight loss treatment and in this field have compiled all of the studies, all of the results of a lot of years of medical research. And they have come down on saying that the goal for weight loss is about 5 to 10% of where the person starts in 3 to 6 months. And that is because of all the studies that have been done that show that that's what people can achieve. So that has kind of been considered the goal for medical weight loss. And people can kind of calculate in their head what that would be for themselves. Now, to some people, that feels like very little. It makes sense to have it as a percent because someone who's starting at a higher weight would have more to lose. But the key thing to know is that that amount, even if you check the number in your head and it seems like not that much, it is very medically meaningful. So what starts to happen when you lose that amount is your diabetes improves, your prediabetes goes away, your knee pain is much better, a lot of your cholesterol, a lot of metabolic kind of factors start to improve, and people report feeling better, better quality of life, and better sleep. A lot of things. Fertility can improve. So that is very medically meaningful. And many people lose a lot more than that because this is very individual. And in particular, one of the newest medications on the market has really shown results that are far above what we have been able to achieve before. So if if it's appropriate for someone to use one of these medications, they might be in a class where 15% weight loss in 6 months would be the average, but it's a huge range. So one person may lose a lot more than that. And in fact, I'm often celebrating with Julia and I and others on our team are often celebrating with people 30, 40 pounds. And that's like so much more than it would have been expected based on the averages. So it's really a very variable factor, but that gives people a sense of, what the goals are from a medical perspective.
Perfect. Well, we're just at 8 o'clock, so I want to make sure we kind of wrap up. Dr. Halperin, do you have any sort of parting words, anything you want to leave everyone with?
I think that, it's been, I really appreciate everyone for coming, for taking their time in the evening. So I want to first say thank you. And thanks to you, Julia, for participating in all the great comments. The main thing that I want to end on is that I hope that medical weight loss really feels like hope. So many people have tried everything. They feel like it's not possible. They've been made to feel like something is wrong with them. And we are here to kind of be supportive, to educate them, to hold their hand, quote unquote, because we do everything by telehealth, and to really offer a different path because we're based on science. We have so many tools and we work so hard to really understand the person and really match the right treatments for what they need. So I hope this feels like there's a hopeful solution that might be right for people even. Just thank you so much for coming, and we'd love to work with you if it feels like a good fit.
Yes, thank you, Kim, and thanks everybody, and hope to meet some of you in the future.